It was a stormy Friday night and the ER was buzzing with its usual chaos, an orchestra of beeping monitors, ringing phones, and the hum of hurried conversations. Amid the controlled chaos, the ambulance doors flew open and a paramedic wheeled in a young man barely conscious with a pale complexion and a blood-soaked shirt. 25-year-old male, stab wound to the abdomen. "BP's dropping, 90 over 60, the paramedic shouted as the trauma team sprang into action. The attending physician, calm yet commanding, directed the team. "Let's get him on the table. Type and cross-match for blood stat. Prep for ultrasound." The patient groaned, clutching at the edge of consciousness. "Hang in there, buddy. We're going to take care of you," a nurse reassured him as she expertly placed an IV line. The ultrasound revealed a critical situation, internal bleeding. The ER team worked seamlessly, each member focused and efficient. Fluids were pushed, blood transfusions were started, and preparations for surgery were underway. Just as the patient was stabilized for the OR transfer, the automatic doors opened again. This time it was a middle-aged woman clutching her chest, escorted by a concerned family member. "Ma'am, can you describe your pain?" asked a nurse as the patient gasped. "Feels like an elephant on my chest. Possible STEMI. Let's get a 12-lead ECG and cardiac enzymes," the physician instructed. The ER split into two zones of intense action, one corner stabilizing the trauma patient, the other managing the suspected heart attack. In the midst of it all, a toddler wailed in the waiting room with a high fever, a young athlete limped in with a fractured ankle, and an elderly man arrived for a possible stroke. The triage nurse moved like a chess master, prioritizing cases with precision. By the end of the shift, the trauma patient was in surgery, the heart attack patient was resting comfortably post-stent placement, and the toddler's fever had broken. Exhausted but satisfied, the ER team knew they had made a difference, one life at a time, in the face of relentless challenges.